my heart health. So
Okay, different. Right.
I've done quite a few podcasts, so I'm getting a bit more comfortable with it now,
Good.
but not on the dentistry one, obviously.
Right, let's start. Good evening to our next Straight Talk. So today is a different Straight Talk than normal. Normally I interview orthodontists and book authors. Today I actually interview Louise, who is the mom of a very special patient in my practice, which is Jaxon. And Jaxon has Down syndrome. And I want to know the whole story because um, treating Jackson obviously made me aware of the need we have as orthodontists to treat children also with difficulties, with syndromes like Down syndrome. And we can eventually help them a lot in their life, in the future life. So, Louise, let's start from the beginning actually. When you conceived the baby, and when did you find out that Jackson would have Down syndrome?
That was after he was born, so it's called a birth diagnosis. So it wasn't beforehand. Obviously, I didn't know anything about Down syndrome at the time, but I was already qualified in early years. So, and I done Makaton as one of my and special educational needs, just like add-ons and stuff. So I was already I felt very prepared. I was like, oh, okay, I know what to do. I can, I'm equipped. It was like it was meant to be. Um, so it
And you
was,
talk about yourself, you weren't equipped, but obviously there was another partner in your life as well at the time. Is that correct?
yes. So that was my husband at the time.
And
Um,
was he as equipped as you were?
oh, he would not have been as equipped as I was because, none of us are equipped. Being born with having a child with additional needs isn't like necessarily something you think about while you're pregnant. But he was my third child. So I've got two previous children and they are happy, healthy. And so when Jackson born, initially the first 24 hours, we didn't have a clue. I breastfed him, he latched on fine.
Mhm.
He had his bowel movement, it was fine. So there was no, and I couldn't see the facial features. The nurses and doctors obviously could. I didn't. He's my perfect baby at the time. So
He's
I
still your
didn't see.
perfect baby.
He's my perfect baby, and it doesn't matter to me. I love him the same as any other child.
And
So
but
then,
what were you told at beginning how your life will be with a child with Down syndrome? So what did the doctor say to you? What is his pathway, which is basically already set for him in his life, according
yeah,
to the doctors?
exactly. So the way it was presented to me wasn't very nice. And what he done, how he presented it, he just lifted Jackson up and hold him on his hand like a doll that was flipping over like a dead fish, and showed me that he didn't have muscle tone and that he suspects he's got Down syndrome. So that was how it was presented initially. And he's the consultant. You'd think he'd be a bit more, I don't even know what the word is, humane about it. So then they just pushed us off into a separate room. You don't go on the ward with all the other mums that just had children. And then they bring you sort of a big folder with all these pictures of Down syndrome and what's going to happen. And, he seems to be okay. He doesn't have a heart condition and he doesn't have a bowel issue. And but all these tests are going to have to take place. So it was a lot to take in. And they didn't initially tell you anything like these are going to be the issues and this is going to be your life sentence. And then it took a few months before we saw a specialist after we were discharged. And then that's when you do your research in that time and can see that children with Down syndrome, you look at life expectancy, you
What
look
is
at,
life expectancy for children with Down syndrome?
I think it is now in the 60s, 70s, but it's not a quality of life those last few 20 years, most probably, because they get all these metabolic conditions like Alzheimer's, diabetes. So, when you do your research when they're a young child, it's something you think of in the future. but I wasn't dwelling on it. But it's something I was aware of because we had so many appointments going to see the doctors, and they take blood tests because there's thyroid issues. They've got to take all sorts of tests all the time, vision, hearing. So then he had hearing loss. That was the first thing that was picked up.
Was it
Um,
hearing loss on both ears or only one?
they can't tell you at such a young age. They just put devices in and see what sort of response they get. So hearing tests, and eventually by the age of 2, he had to get a hearing band fitted to his head because he couldn't hear. And I think the device showed that he had 50% hearing loss. Whether it was right ear, left ear, we can't definitively say. In the meantime, sleep was a terrible event. Toilet training was difficult. All these things that typical children just flourish at is a longer path for us. Then he was diagnosed with sleep apnea, and we had to get a CPAP machine. And this
What
was
age was that?
about age 4. So
Hmm.
that was 2
Can
years
you
after his
explain
hearing.
to the normal people what a CPAP is and how do kids feel about having a CPAP?
So CPAP, they call it a continuous positive airway pressure device. So it's sort of like a hairdryer, if you can imagine a mask fitting over their face. So the air just continuously blow to keep the airway open so that he can breathe and stop having non-breathing episodes as such.
How
Uh,
many episodes of not breathing did he have at the time? Do you remember?
I can't remember the exact amount, but it was just restless sleep all night long, gasping for air, tossing and turning. And the only way they done that is when we had in hospital stays, and they set you up in a sleep study room, and they have all sorts of straps and devices on him and a camera, a night infrared camera. So they have all that data, and obviously they diagnosed him with severe sleep apnea, whatever that severity is. It might be stop breathing 10 times a minute. I don't exactly know the criteria that they do fit in, but yeah, that's the respiratory specialists field that they know. And then the more I researched, I realized that this is for life, the CPAP, and it was so difficult to get it on his head. He was just always fighting, crying, and then if you put it on, he rips it off. Yeah, so that's the sleep struggles we've got.
So with the sleep struggle, obviously that means if he's not sleeping, you're not sleeping.
That's right. Up and down. And then he won't sleep in his own bed. He'd climb out, come and get in bed with me and my partner at the time, his dad. And it felt like you play sort of musical chairs all night long. And then I'll lay on his floor in his bedroom, try to put him back to sleep. And, we would get very little sleep every night for many years.
Wow. So how was his behavior? Because he didn't get good night's sleep. How would you say was his behavior during the day?
So when he was younger, there wasn't much verbal communication. So we had done Makaton, which is sort of like sign language, but with verbal, because he could hear, he wasn't totally deaf. He could, like, if you sign something like this, it's Makaton or mummy or daddy, he could sign, but the frustration is there. And then he's tired, he's got dark circles around his eyes. You could just see it was just always difficult. And then I think it impacted on all the other areas of eating or not eating, struggling to go to the toilet. As such a young child, then he's had frequent infections in hospital for chest infections frequently. There's just, it's all we can't pinpoint it down to one thing, but if you don't sleep, it has a big impact on your daily life, not just for the child, but as the parents as well.
So when Jackson came to me, he had already multiple baby teeth extracted. How was this journey? How did that all happen? How did it come to this dental care where they just extracted teeth? Tell me about this.
Yeah, so again, I noticed that his teeth was going rotten.
And was that
And
because of poor diet, would you say? Was that because he couldn't brush the teeth, or was it because he was mouth breathing?
it could be a multiple factors that all three factors taken into consideration because his mouth was so tiny, I would struggle to even get a toothbrush in there. First of all. Secondly, I thought I was feeding him healthy fruit and fruit juices. And, there was a lot of, he was allergic, or they said he had dairy intolerance and soy intolerance. So I was buying all this stuff that was dairy free, soy free, cakes or biscuits or whatever when he's a child, or the crisps, all of that starches, I didn't realize turn into sugar, but nobody ever tells you this. So even though I thought I was doing the healthy thing, preparing good meals at home and giving food that's got no gluten or stuff like that, it all turns to sugar
So there
on
was
the
no
teeth.
advice from any professional body on how to feed your son.
No, I was just following mainstream, what everybody else was doing. And they just said, cut out the dairy and give him oat milk. Um, and give him soy-free products.
But so then you changed the diet, and so did he now. So how did that happen? Was it social media awareness, or how did you now change to this carnivore diet?
So this is what happened in lockdown when we don't have access to medical care anymore. You can't just visit a doctor. Then I went and done my own research because I was very unhealthy myself in metabolic terms. And I had a call from my doctor that I might have cancer on my liver. So I had to go for urgent cancer scan. And that got me to Dr. Google. And I found out about the whole low carb world and how stuff like rice and potatoes and pasta is actually just metabolize the sugar in your body. And as soon as you put it in your mouth, you start chewing. There's an enzyme called amylase that turns the starch to sugar. And again, I'm not a medical professional, but I've learned all of this over the last 4 years myself. And treating the root cause fixed all my issues. And then I translated that to my son because I realized, well, people with Down syndrome get all these metabolic issues as well, but just sooner in life than the general population. So once I then realized all these things, because sleep apnea improved with the low carb diet so much on so many of the adults, because they lose weight. And then I thought, okay, well, that's obviously going low carb would suit him as well for the rest of his life, for the longevity. But we need to get to the root cause, because at the end of the day, just a CPAP is masking it. He's never going to get better. And then as I continued on this journey of low carb, real food, I found dentists who followed carnivore lifestyle in names that you might recognize. Kevin Stock was the first one. And then he's doing interviews with people like Stephen Lin. And then I think one or both of them were doing interviews with Renata and her surname Neem or something.
Yeah, from US. I know her.
Yeah. And then, when I listened to what they're saying, I was bowled over and I was like, right, I have to find somebody who is going to do the treatment they're doing on themselves and adults to do it on my child as an early prevention, treat the root cause. And so I went on Dr. Google again, or the University of Google, and I found yourself and how you were speaking on interviews and being so passionate about your own children.
But before that, obviously, you said, I want to find out the why. And I'm sure you went to some professionals and said, look, guys, I understand you want to give him medication, you want to do this with my son and this, but can you not explain to me why this is happening? How was the response when you approach a professional about finding different answers to the problem? What was the response in general?
They just don't listen to me because he goes to a specialist dentist on the NHS. They don't go to the main dentist. Because he's got Down syndrome, he gets access to the special dental care in the area. And I explain these things to them and they just look at me blankly with like a glazed over look and like, well, that's just it. Because he's got Down syndrome, that's just his cards he's been dealt. You've got to accept it. That's how I feel. There's no communication. I'm trying to say, like, look, support me in this. The same as I went, because, like, again, my lifestyle changed. I went to my cardiologist and I've changed my whole life around, fixed my obesity, high blood pressure gone, off arthritis medication, all of this, and expecting them to be happy for me. And they were like, oh, well, and you feel scientists need to question, why is this actually happening? We've never seen such a healthy heart patient in my facility before. Everybody's just worried about my cholesterol now being high because I'm eating so much animal product. And I'm telling them the same applies to Jaxon. It's like, why is this happening? Surely there should be other interventions we can do. And again, from the interviews with Kevin, Stephen, Renata, I realized that the facial structure needs to change, opening up the airways. That's where the solution lies, not just pulling out teeth and doing nothing. He can't chew properly. He can't breathe properly. So what do we do? And the mask doesn't work. So I was
It's
just
quite
not happy.
frustrating.
Yeah.
So then obviously we met and yeah, I am very passionate about these things. And Jackson obviously is one where it's really changed my perception to prevention because it's super emotional. So we did expansion. Actually, we had some issues with the first round of expansion because, to be fair, like I was still thinking as an orthodontist, thinking we need to expand the palate, we need to protract the maxilla, and we had these hooks on the device. And what I didn't consider at the time was that Jackson has a high infection risk, and he got some abscesses from the palate expansion, and we had to basically take it out before we wanted to, right? And we had to do a second round with a different design. We didn't do the protraction. So explain to me, I mean, I know what changed the moment we started this palatal bone expansion with Jackson. What changed for you? What changed for Jackson? What changed about his sleep? What changed about his breathing? What changed about his behavior, about his life? Just tell the people what changed.
Well, first of all, you were prepared to take him on as a young patient at the age of, I think he was only 8 then. So that was the most important thing for me, to get somebody who will listen to me and work with me and take on a young patient. Because in the NHS, you just get told, no, leave it until it's 12 years old or 13, and we'll see then where we are. So that's where the first step came in, like somebody is willing to work with me. Then I won't say it was plain sailing, because it's really, to keep it clean and follow the instructions, the scanning. It's all, it takes a lot of work and effort. But I explained to Jaxon, and we watched a lot of your videos, so I make him mentally prepare of what's going on. And he is very compliant then. So what changed is, I think he did sleep a lot more peacefully. As a lot of the snoring went away. So I wouldn't say it all resolved, but there was definitely improvements. He stopped wetting the bed, because that was frequently wetting the bed. So yeah, he woke up with more energies in the morning. So he'd be waking up at 6 o'clock in the morning and ready for the day. His appetite grew so much. He can eat a man-sized plate of food now. It is quite incredible. And the other thing is posture, and not falling over so much when he was running. So his posture came up. So he was always hunched forward like this. So I noticed the posture changing. And again, everything from the mouth has got so much to do with the posture. And this is, again, I'm not a medical expert, but I've done my research and find out all these things myself. And I
But
want other parents
you
to do
had
it.
eyes. You are observing your own son.
Yes.
And yes, it might not be clinical evidence, but it's your eyes and the gut feeling of a mother who raised this boy that things are changing in a nice way. I think this is evidence enough for most of the people out there, for them to have a go at this. So,
Exactly.
but
So
what also was for me very emotional when you wrote me the message and he had the audiology test and he suddenly his hearing improved. How was that
so
for you?
yeah, well, I told him that I believe it's this expansion that was going on in his mouth, because then expanding his palate made the tubes in his ears straighten out, because they've never, since he's been a baby, been able to see his eardrums. And he, after the hearing aid, he had in-ear hearing aids for many years. And then the hearing improved before the intervention, but I think that was very much diet related because of dairy being cut out and stuff like that. But he wasn't quite in the normal range yet. And then only a few weeks after the palate expansion device, the first round, I think, his hearing went into the normal range. And that's never happened. So since he was 2 years old, he basically was quite, he had quite a hearing impairment. And then not long after that, even school said his speech improved, his behavior in class, his concentration. So that was a report the school wrote without knowing the intervention that has happened in his mouth would have the impact on that. So they just observed it themselves, and it's written in his report.
So basically, we're coming back to more a normal child's life.
Yeah, it's just like another typical child, and he is taking part in class activities longer now. He can sit in a group now and understand what's going on in the world around him, where before he would be just sitting there, like if there's a assembly going on and everybody puts their hand up, he'll put his hand up, but I have no idea why. But now he can hear better. His speech has improved, so it's more clarity of speech. He's gone up so many reading levels, 3 reading levels since we've last saw you. So
Wow.
there's just so many things that's just accelerated so fast in the last, and I've only started seeing you, I think it was September last year. So there's been so many improvements in a very short space of time.
It's quite emotional.
It is.
So, and obviously, I have to say that you are following guidance very well because now we also introduce a certain sleep hygiene protocol. We are doing nasal rinses. And now the latest thing, which is you started testing Jaxon with oxygen meter.
Mm-hmm.
Tell me about this. How did you get this idea? Because it's a brilliant idea.
Well,
So,
again, it's from you mentioned these things in your practice when we're there. And I take it in the information, and then I go home and I research it. And I found this little oxygen meter at online myself, and it's got an app that can monitor then his oxygen saturations. And he was sick that 1 week, and you could definitely see the drop in the saturation. And the following week he was better, and it came right up again. And his noisy breathing is a lot less. So there is still a little bit of noise, but not compared to us. It used to be so snory, like an old man. You couldn't sleep in the same room with him. And now it's a lot quieter.
and also you started taping his mouth now. How is that going?
And again, you asked me to try and do this, and we've moved on from like 5 minutes to now 10 minutes. And he actually comes to me and asks me, he says, don't forget to tape my mouth. So, and he likes the nasal rinses. Again, you've mentioned it, and we rinse it, and every night. Then when he has the rinse, he breathes in, he goes, and he just loves it. He can feel it for himself. He's 9 years old. He's got Down syndrome. You would think he doesn't understand, but actually he understands so well.
So would you say he's so compliant because he understands it makes him feel better?
Yeah, because he's asking for it now. In the beginning, it was a bit of a struggle, and I say to him, "Oh, Dr. Decker is asking me to do it, and he loves you so much, he will do anything what I say." He's like, "Okay, I'll do it." So yeah, I think that, a lot of people make an excuse, my child will never do that, won't never do that, and put limitations on their child because they've got additional needs. But I think that I demonstrated to him and he feels the benefits, that eventually he's now, like I say, asking for me to do these rituals at night, rinsing his nose, and in the mornings before school. So he must definitely feel the benefit.
And you mentioned all these dairy restrictions he had from the beginning. Um, is it getting better since then
Yeah.
with the nasal rinse? Is he still very inflamed in his nose, or are things improving also in the nose area?
I try to limit dairy, so he only has a bit of milk and a bit of Greek yogurt now and again. Otherwise, he doesn't eat cheese. We don't have cereal, so he never has milk and cereal. So there's a big improvement. There's no more. When he was little, it was, again, people with Down syndrome. It's just the norm. They all walk around with these snotty noses and infection all the time. I live in the Down syndrome world because of our charity that we run. And so I see all the children. And it's not to blame anybody. I'm just saying it's an observation. And this is the general case. Jaxon is clear. He no longer have, he used to have rashes on his nose and his lip and sores. He's absolutely clear.
So if your colleagues you just mentioned in your charity are seeing the changes in Jackson, what are they telling you?
No, we don't speak about it because it's such a sensitive subject. I think people will find it weird if I start saying you have to do these dietary changes and go and see somebody to fix their cranial cavity and do this. They all think I'm crazy.
But they see Jackson, don't they?
And that's it. You can just keep planting the seed. You can't force other people to do anything. And I think that's how it worked for me. When you see with your own eyes, then you plant that seed and maybe somebody else will go, I want a bit of that.
But I'm sure they have faced similar stories you face with the medical professionals. And why is it, in your opinion, that some say, oh, no, no, there's nothing, we've continued following these medical professionals, the life is deemed of our child. Why are they not open to listen to something different which could potentially help their children? What is your personal opinion on that?
People just believe what doctors have said for the last 100 years and nobody changes. So I think that we need to, people like me challenging the doctors, going, well, why didn't you tell me? Why didn't you know? Is how we get here, by changing professionals, not because I'm arrogant and I know better. I've got no idea about your profession, honestly, but I know that what we can do to get to the root cause and where I need to go for the help.
I mean,
But
look,
everybody isn't like me. And so that's why they just think they can get a pill or an
I think
injection and it will fix it.
I think it's a fair thing for a mom to ask why. I think there's nothing to do with arrogance. There's nothing to do with I know better. Something everyone has a right to ask, why is it happening? And that doctors maybe should investigate themselves in their profession. Or actually, I have nobody ever told me why. Maybe I should do some education on finding out, is there a why? Or is there more research nowadays that could explain more the why? Because nowadays we live in a more hybrid world. Education is much easier accessible as 20 years ago when no internet was present. So everyone is allowed to get information, podcasts, social media. There's a lot happening now, but I agree with you. Like as a teacher, that it's sometimes very hard to make people understand they need to be open for new, because what they don't understand, professionals, is by the time they're graduating, that 50% of the knowledge they gained in their studies is outdated by the time they graduate. The problem is they don't know which half it is.
I
And
know that saying very well.
so I've just this week, I left a clinic in London where I did what I did. And the orthodontist who came after me, he doesn't want to see any patients of mine I treated before because he says it's all nonsense. So I find, and he's in his late 20s, freshly graduated, and I find it astonishing that the new colleagues, young colleagues, don't want to listen to someone maybe more experienced in life in orthodontics, that there might be something there which could help children. So this is also from my perspective as an educator and academic, very sad that at least not the openness to listen and to question maybe the status quo they're having. And by stories like your story, which I tell everywhere, you have just observation, but this is the evidence we have at the moment because we need probably hundreds of Down syndrome children treating the same way with the same outcome to have some kind of scientific evidence. But what you're telling us now is so much, so much value in it because it's also emotion. It's your story, it's Jackson's story. And now going forward the next 10, 20, 30 years of his life, where do you see his life going now?
Yeah, well, this is it. The biggest reason for all of this is the quality of life, having expanded his life maybe 10, 20, 30 years with more quality. Because again, I work in the community with all additional needs people, and the quality of life of these people are really, really terrible. I see it daily with my own eyes, and I don't want that for him. And now, with all this newfound treating the root cause, I can see such a bright future for him that he can work, he can probably drive a car one day, his cognitive abilities will be better. I can see it. And that's,
You just mentioned these struggles families are going through. What impact, like obviously, I know you're separated from your partner now. And I know from Jackson's story that has also impact on his life, not only from his emotional state, that the parents are separated, also that his health sometimes goes up and down because he's in different care. And I'm pretty confident that this situation happens quite a lot because it is a very difficult situation to deal with kids with needs, and it is impactful on the relationship. It takes a lot of strength in the relationship. So, how is Jackson coping with this situation between parents being separated? How is Jackson in this?
he can't verbalize probably, but he does have emotional sort of like he misses daddy, or then he's with dad, then he'll phone me. So I think he does know that he's got different homes, so there's not that stability. And again, like I said, the routines, washing his nose and cleaning his device, and what else do we do, the CPAP, all these rituals we do is maybe different at daddy's house. So I can't speak for that. And I think that it does have an impact on him emotionally. Again, he can't verbalize it the same as another maybe, but I think no 9-year-old can really verbalize it. And we have to do the best we can by our children. But again, as adults, seeing this, most of the adults I work with, their parents are all separated as well. Because I think that, again, this is just maybe observational. Once again, there's such a high separation rate because of these extra pressures from an additional needs child. Who knows?
So basically, you would say it's quite a norm that parents with a child in need are separated.
Yeah. But if we could do the prevention and having these early interventions and have a better quality of life in the beginning, we won't have these struggles for 3, 4, 5, 10 years, causing more and more strain on a person's relationship. So I think this is why early intervention is so key.
And when you talk about early intervention, obviously I can play my role in this whole puzzle. But who do you actually see right now who helps you in this journey to get Jackson better? Who do you see?
We've got a whole team of professionals, but nobody's there to help. It's just to monitor. So taking bloods, hearing, sight, gut issues, heart. He's got a scan for his heart coming
So
up.
they're
So there's
all treating
nobody.
symptoms.
They all just, yes, treating symptoms if they're going to come, because they say, be careful, children with Down syndrome get celiac disease quite often. They get thyroid problems. They get this, whatever the list is. So we just have to keep testing to see when they get
So
it,
they're
then
waiting
medicate
for it
them.
to happen.
Yeah. And then when it's happened, yes, some pills to mask the problem and prolong the suffering more. That's how I see it.
So where are you in your research in that now?
Well, that's where I'm deep into the nutritional research and having optimal nutrition, because people will look after their cars better than they look after their own bodies. They put in anything in the top year that's all processed in a factory, rather than thinking about what nutrition are you actually putting in. And I try to give my child and myself optimal nutrition so that we have healthy, long lives.
Which is nowadays actually quite hard if you go in a supermarket to find good nutrition.
Yeah. So that's why I don't go in a supermarket. I go to my butcher and that's it.
What's your dream?
He's like leaving a legacy of being the first child being treated this way, and sleep apnea doesn't even feature in his life anymore, because the consultant says it's a lifelong thing. You never grow out of it. And I want to prove wrong, not to be horrible to prove wrong, but to just say, look, if we all look at the root cause of problems and fix that, rather than just putting band-aid over band-aid, then, that would be fantastic.
What would Jackson say? What's his dream?
He wants to be the Hulk. Yeah. I mean, he doesn't like wearing the CPAP thing on his head. So as soon as it comes on, I switch it on, he rips it off, he gets in a panic, and then he can't fall asleep. I try to put it back on. So he doesn't want it. So he will definitely say he wants to breathe properly.
So what needs to change in our system for kids like Jackson to get help?
Professionals need to talk together, and the people think that holistic treatment is just one specialty, and then having a degree in medicine that's nice guidelines and the NHS, that's the way to go. I think that people need to come together. The team around the child needs to work for that child, every child. How do you make that happen from government? It's, yeah, I don't even have an answer for you, but I think grassroots, people like myself, we have to come out of the woods and try the best for our children, fight for it. And that's what I'm doing.
How do you fund all this? Because I'm sure when you go to different professionals, it's not funded by the NHS,
Yeah.
like myself.
Yeah.
So how do you feel like going from these different professions asking for help, and you might need to have funds for affording them? How does that make you feel? Should it not be accessible to anyone?
Exactly. So it's not easy, but what will a parent do? They'll do anything for their child. So yes, I've taken all their savings. I've taken all my savings and I will put it in his teeth, because I know that it will be so life-changing. The NHS just provide the service they provide, but it's a band-aid. So at the minute, to find funding for private treatment that's not on the NHS is impossible. What do? I go and I'll have to do, what is these GoFundMe pages or something, raise money that way, contact charities that will maybe help. I don't know. It is really, really tricky.
So I ask you a question now. Obviously, we mentioned at the beginning when he was presented to you when he was born like a fish on the hand with no tone. So he obviously kids with Down syndrome have a low tongue tone or muscle tone. And there are now some kind of pacemakers available for the tongue,
Mm.
which are basically implanted here and to his neck. How have you done any research about that?
I have. He's a respiratory specialist mentioned it, and so she's going to talk to the team in London in some sort of hospital. And because he's still so young, that they might look into it. But I don't feel like I want an operation where they put it in his neck. Uh, you know, I, I don't know if I would want that because it's so invasive. Why would I?
You
I
know,
can't.
I tell there's a famous ENT surgeon in America, Stanley Liu. He's in Los Angeles. And he actually said just recently in a podcast that for children, there's no intervention.
Yes.
So we as dentists and orthodontists, we are the rhinology. We are the whole ENT department for them because this is the only intervention that is actually feasible nowadays because of the young children. No surgical intervention is available.
Yeah. So they're busy talking about it for Jaxon, and because they say it's only in adults, but what they do in adults as trials then translate to children eventually.
But yet,
But
that translate doesn't mean they have access then to it. They talk about it, but nobody's actually doing anything.
yeah, I I can see how it would work because it's still the same sort of physiological, the muscle tone. If the child needed a pacemaker, it would be similar in an adult to a child. They've got a heart. So this is the same. They've got a tongue, there's a muscle, it stimulates that. I guess that's it's it's the surgery bit that bothers me because he's already, when I had him in my hands and I had to have him put under for the general anesthetics, that feeling of the child just going in your arms is so horrible. I can't explain that to a parent. You never want to put your child through that. It looks awful, and you've got to be there in that operating theater when they put the anesthetic in. I don't want that. So to put my mind back to there and having to take him through that process where they cut into his throat, I can't.
I understand that.
So this is why your treatment is non-invasive. It's just a palate expansion device that goes inside his teeth, and it's just expanding naturally, slowly. He had no pain, discomfort.
So we changed recently to clear liners with Jaxon. How is he coping with clear liners now after the expansion?
Yeah, he's absolutely fine, and he can put it in and out himself now. It's like he's a professional and he knows how to do it, and very compliant, very easy. Yeah, he's
So no struggle
fine, and he
anymore.
goes to school with it, and he's absolutely very good. I can't complain.
And lastly, to finish off, do you have any questions to me? Um, you always wanted to ask, but we never had the time to ask.
No, yeah, can you move closer? So that's the other thing of the story is you are so far away from me that I have to drive at least an hour and a half every time to come and see you.
This is
And
why I need training.
I do it for my child. So not that I would want, if you were 3 hours away, I would be driving. So yeah, it's like, how are you going to expand this so it's more accessible to people in all the towns around the whole country? There you go.
That's, I'm trying already. I'm trying to teach. And we're still at the beginning of this because when I realized this story, I said it's good that my patients benefit from that, but it's not good enough because my patients travel a lot to me. And it's quite the norm actually that people travel more than an hour or two to me
Yeah.
rather than exemption. And actually, when we wrote the business plan, we calculated We have 25,000 children in 5 mile radius. But now my patients coming from hundreds of miles, thousands of miles radius to me. So that's why it made me believe in that I need to educate, I need to teach professionals, dentists, pediatric dentists, orthodontists to do this. But as you mentioned now the whole time, it's very hard to convince someone and to tell someone they might not know. Because if I tell them they might not know something, they might feel a bit insecure. I take them out of their comfort zone, and that takes a lot of courage to change potentially. And that change is not easy, and I'm trying, and we are getting slowly to points where it's really good. But this, I can only do this for you. So I try my very best to get more and more dentists here to ask to be educated, because more and more kids. I mean, I'm dreading the day where we publish this to your community, because I know what's going to happen when somebody with a child like Jackson says, I want to try this. So, I mean, it's the beginning. And like I said at the beginning, like Jackson is a very special case for me because it made me aware that what we do or can do is good, life changing. And we're not talking really about teeth, it's a life. All you talked about is life.
Yes.
And the teeth
Quality
are
of life.
a
Quality of life.
tiny part of this journey. So we are not actually changing the teeth or the smile. We are actually changing and transforming the lives of these young children. And everyone deserves to have a life and quality of life. I will keep going. Any other questions to me?
No, no. Thank you so much. We can't thank you enough. Keep
You don't need to
going.
thank me.
Never give up. Your passion shines through, and that's why we come.
Thank you, Luis, for taking the time. I think it's important to share the story of because I think a lot of parents are out there who feel similar things in different ways. So reach out to us, and thanks, Luis, for taking the time tonight. I see you
Thank you.
soon in the practice.
Thank you.
Bye, everyone.
Bye-bye.